Is the Executive Director of Covered California here tonight. Once again, thank you to answer any questions people may have about their healthcare options. So let's start with this deadline of January 31st. This is a hard deadline for a lot of people, but there are some special circumstances where you would be able to sign up after the deadline. What would those be?
Well, come on. So this is a rock solid deadline. If you don't have insurance now and your circumstances don't change.
Okay.
So we want to get the word out. We don't want people to pay penalties, all that stuff we can talk about. But if, let's say in 6 months, you lose your job, you lose your insurance, bam, you can come on and get insurance and we'll be there for you. If you move, if you live in Nevada, move to California or vice versa, you can get in, you can get there. So change of circumstance will happen throughout the year. But for most people, if they miss this deadline, they're going to go a year without health insurance, and that's what we want to avoid.
Now, if somebody is already part of Covered California, but they just don't like the plan that they're in, would that be a circumstance where they could change down the road?
Many have chosen to do that. In the part of the renewal process, you change during open enrollment.
Okay.
And we've had thousands of people that change. Most people like their plans and stay with them, but it's during this period, this open enrollment period, exactly when people that are in can also switch plans.
But only during open enrollment.
Only,
so you want
only
to make
during
that
open
clear.
enrollment.
Okay,
Yep.
now you said that the circumstances do change for people. Things like subsidies, is that something you see people apply for if, say, they lose their job halfway through the year?
If you lose your job halfway through the year, and one of the things, at Covered California, 9 out of 10 people get financial help, these subsidies. If you lose your job, need health insurance, you're eligible for those subsidies. Based on what your income is, you can get some of that financial help. That means for Californians, we got hundreds of thousands that are paying less than $50 a month because of the subsidies. And that's available throughout the year if you're eligible, but you got to be eligible.
One of your big headlines this year was adding dental coverage.
That's right.
What kind of response have you seen?
It's been huge, actually. We've had more than 150,000 people sign up. Now, dental isn't subsidized, but people say, you know, we got a good deal and taking care of your teeth is part of good health. So we've had a lot of interest in signing up for the dental coverage.
People may be still doing the equation as to, is it just cheaper for me to skip health insurance and pay the penalty, or do I need to sign up? Does it make more sense to sign up for Covered California? What is your argument?
Well, it's not an argument. It's a matter of how much you want to gamble, how much you want to roll the dice, because you go without insurance and you can't afford it. If you can't afford it, that's the only time you pay a penalty. If your insurance is too expensive, there's no penalty. But if you can afford it and you're going to pay a penalty, that penalty is going to be big. That's a sure thing. Minimum $700 a year. It could be as much as $10,000. Family of 4 making decent money that goes without insurance. That's writing a check to the IRS to get nothing. The rolling the dice, though, is you show up at the emergency room, you could walk out with a $50,000 debt.
Right. It's a major reason that people file for bankruptcy.
Yep.
So the last question I have for you is political. We're doing a lot of political coverage right now, and in a presidential election year, there's still a lot of talk about ending Obamacare on the campaign trail. So is that affecting things for you at all? Are you feeling any pressure?
It's really not. One of the things that's been great about the state of California, we said, let's put the politics behind us and make this work for Californians. We're seeing people sign up. We've also seen around the nation, the governor of Kentucky ran on a platform of overturning Obamacare. Once he got in office, though, he said, boy, people in Kentucky are insured. I'm not going to kick people off insurance. So I think after we get through the political cycle, we'll get back to the art of governing. And we've got a program that's working in California, it's working across the nation, and we're trying to get people in the door. So that's what we're focusing on.
Okay, Peter Lee, thanks as always. This information affects millions of people, so we appreciate you coming on.
Great to be here. Thank you.
Kelly.